1792, a bullock driver named Cowasjee has his nose and one hand cut off as punishment. A year later, he has a nose again. When British surgeons stationed in India saw Cowasjee's reconstructed face, they were stunned. It was a functional replacement built from a flap of his own skin. What those surgeons didn't realize was that the technique they were marveling at was roughly 2,000 years old. It originated with an ancient Indian physician named Sushruta, practicing in the city of Kashi, modern-day Varanasi. This ancient manuscript maps out anatomy from the Sushruta Samhita, and its scale is staggering. It organizes surgery into 8 classifications, details over 300 specific procedures, catalogs 120 instruments, and describes exactly 1,120 diseases. The Samhita functions as a comprehensive, strictly organized surgical blueprint. It maps out a medical science that was established millennia before any comparable system appeared in Europe. To reconstruct a nose, map the defect using a leaf. Trace this on the forehead, cutting a matching flap. Leave an edge attached between the eyebrows for blood supply. Rotate and suture this living flap over the defect. Carrying continuous circulation, it perfectly integrates. This concept, a pedicled flap that moves living tissue on an intact blood tether instead of relying on a severed graft, remains the foundational logic of reconstructive plastic surgery today. Writing a surgical text this precise requires exact knowledge of human anatomy. But ancient India held strict religious and social taboos, treating corpses as sacred. Touching a dead body was considered a severe violation. The text provides a hydrobiological workaround. A cadaver would have its intestinal contents removed, then be wrapped tightly in grass, bark, and natural fibers. It was placed inside a protective cage and submerged in a shaded, slow-flowing river for exactly 7 days. The river current naturally softened the tissue and washed away surface bacteria. On the 7th night, surgeons removed the body and performed a bloodless dissection. Instead of slicing with a blade, they used brushes of bamboo and coarse grass, gently rubbing the softened tissue to peel the body back. By leveraging the river's natural decay process rather than fighting religious law, ancient Indian physicians developed a structured, repeatable method for anatomical education centuries before formalized dissection existed elsewhere. That deep anatomical knowledge led to immediate surgical interventions. The text mandates the administration of wine and cannabis before an operation to actively manage shock and dull pain. Surgeons closed wounds using sutures spun from flax and horsehair. For the most delicate incisions, they applied live ant mandibles, clamping them shut to act as biological staples. They dressed those wounds with honey and turmeric, utilizing their natural antiseptic properties. When we talk about who actually wrote these techniques down, the history gets blurry. Much like Hippocrates in Greece, Sushruta likely represents a name attached to a long, evolving lineage of teachers and students. The oldest physical fragment of the text we possess dates to 878 CE. It shows evidence of being revised and expanded over hundreds of years by later scholars like Nagarjuna. This scholarly uncertainty doesn't weaken the genius of the work. If anything, it proves the knowledge was robust enough to be carried forward, tested, and refined across hundreds of years of active medical practice. This knowledge survived through 2 different channels. First, there was the archive of the text. In the 8th century, the Samhita traveled to Baghdad, was translated into Arabic, and shaped the encyclopedic works of Islamic medical giants like Ibn Sina. But the specific forehead flap rhinoplasty survived closer to home through a second channel, the archive of the hand. It bypassed elite academic hospitals and lived on through an unbroken lineage of Indian artisan families, including Maratha potters. These craftspeople passed the mechanics of the surgery down silently, generation after generation, operating on victims of war entirely outside the official medical establishment. Knowledge can endure through formal scholarly translation and massive libraries. It can also survive through the unrecorded muscle memory of working-class families who quietly do the work. Which brings us back to Cowasjee's reconstructed face in 1793. The British officials who documented the surgery and published it in London never recorded the name of the Maratha craftsman who actually held the knife. Instead, an English surgeon named Joseph Constantine Carpew read the magazine account. He practiced the technique, performed it in London in 1814, and became the named pioneer of the operation in Western surgical history. The official history of medicine operates through a lens of power. It cements the legacy of the European who published the technique, while erasing the indigenous hands that safeguarded it for 2,000 years. Today, that same forehead flap remains a foundational procedure in modern reconstructive plastic surgery. It is taught globally to treat severe nasal defects, and in surgical literature, it is still officially referred to as the Indian method. The hands that actually rebuilt his face were never named. The idea behind them is nearly 2,600 years old, and it's still the one plastic surgeons use today. What does it take for a technique to outlive every name attached to it? A medical breakthrough lives on when its utility outlasts its documentation. 2.5 millennia later, the living tissue of a human face is still being healed by this specific ancient idea.